Hello. My patient is Elijah Garcia. He's a 21-year-old male with gastroesophageal reflux disease. The patient takes Prilosec, Zofran, acetaminophen, naproxen, and ibuprofen, and has no known allergies. So I'm going to go ahead and start off by performing hand hygiene. Okay, and then I'm going to go ahead and gather my supplies. So I'm going to need a stethoscope, my blood pressure cuff, an alcohol prep pad to clean my stethoscope, a pen light, a pen, and then a blank sheet of paper so that I can just go ahead and document my vital signs. So I'm just going to show that it is completely blank, and then there's nothing on the clipboard. So I'm going to go ahead and set this here. Alright, so I'm going to start off by knock knock and announce my visit. So knock. Hello, my name is George Gonzalez. I'm going to be your student nurse for today. So I'm going to go ahead and start off by providing the privacy. So if there's a privacy curtain, I'm going to close the privacy curtain, or I'm going to go ahead and make sure that the door is closed. I'm going to turn on the overhead light, and then I'm going to identify my patient using two identifiers. So can you go ahead and give me your first and last name, please?
Elijah Garcia,
And then can I have your date of birth?
August 31st, 1999.
Okay, thank you, Mr. Garcia. Alright, so today I'm going to go ahead and do a head-to-toe assessment. Is that okay with you?
Yes.
Yes? Okay, so I'm just going to go ahead and start off. Can you go ahead and scoot up a little bit for me? So how's your day going today?
Good, how about you?
It's going pretty well, thank you. How are you feeling today?
I'm feeling good.
Feeling positive today?
Yes.
Yes. Okay. Just gonna set that aside here. So I'm gonna go ahead and start off by taking your heart rate. So if I can go ahead and see your 10. I'm just gonna go ahead and see your radial pulse here. I'm gonna count for 30 seconds. Okay. 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 And you go ahead and take your blood pressure. So they can go ahead and see your right hand, please. I got this around here. Okay, so I'm just gonna go ahead and take your palpated systolic pressure. Palpate. it returns at 100. So I'm just going to go ahead and push all the way to 130. Okay. So while that happens, I'm going to go ahead and use my alcohol prep pad so that I can clean my stethoscope. So I'm going to dispose of this. And I'm just going to go ahead and clean this. How's that? Okay, so does your arm feel ready?
Yes.
Yes. Okay. So I'm just going to go ahead and take your blood pressure. Got 112 over 76, which is pretty good. Go ahead and write that down. Okay, 76. Okay, so I'm just gonna go ahead and ask you a few questions. Do you know where you are today?
Yes, my house.
Yes, okay. And then do you know what day of the week it is?
Yes, Wednesday.
Okay. And then do you know what we're doing today?
Yes, my head to toe assessment.
Okay. So I'm just gonna go ahead and inspect your eyes really quick using my pen light. So just go ahead and look at the light for me. So I'm just gonna cover this side. Okay. And then are you in any pain today?
Yes.
Yes. Okay. And then what kind of pain are you in?
Cramping.
Cramping pain? Okay. How long have you been feeling this pain?
For about a month.
About a month. Okay. Where's this pain at?
In my upper abdomen.
It's your upper abdomen. Okay. And then how bad is the pain? Is 0 to 10? Can you rate it? 0 being no pain, 10 being the absolute worst.
At 8.
An 8. Okay. And then do you have like anything make it worse?
When I don't eat.
And then anything make it better?
When I do eat healthy foods like salad.
Okay. And then is there anything else that comes along with the cramping? Like do you feel anything else?
Vomiting, and then I get nauseous as well.
Okay. Well, I'm sorry that you feel that way. Okay, so I'm just going to go ahead and move on with the assessment. I'm just going to start off by inspecting your chest area, making sure that your breathing is even and unlabored. Okay, so everything looks fine, making sure that your skin is intact and that the skin color is correct for your ethnicity. Right, and then I'm going to move on to assessing for skin turgor. So I'm just going to grab and pinch at the top of the clavicle, making sure that there's wrist return. Okay, and then I'm just going to go ahead and auscultate. So I'm going to grab my stethoscope and I'm going to go ahead and listen for some lung sounds, okay?
Okay.
So and for you to help me, I'm just going to need every time that I put the stethoscope on your skin, just go ahead and take a deep breath out and then out your mouth and in through your mouth.
Okay.
And then we're going to go ahead and do this. If you do feel lightheaded, just go ahead and stop or let me know. We can stop the procedure and then we can continue whenever you feel ready, okay?
Okay.
Okay, so starting at the apex, I'm going to go from left to right. So remember, every time I touch, go ahead and take a breath, okay? Okay, good job. So now I'm just gonna go ahead and check for your heart sound. So for this one, you can just breathe normally. I'm gonna turn this over to the bell side. I'm just gonna go ahead and listen to your heart sounds, okay?
Okay.
Okay. So everything seems fine there. I'm gonna go ahead and move on to abdominal section. So again, I'm gonna go ahead and just inspect, making sure that your skin color is good for your ethnicity, making sure that your abdominal area is contoured. Okay. Making sure that the skin is intact, there's no moisture, and your skin is dry. Alright, again, I'm gonna go ahead and grab my stethoscope just once more so that I can go ahead and auscultate for any bowel sounds in all 4 quadrants. So I'm gonna kind of be moving in like a rainbow motion, okay?
Okay.
Okay. So next I'm just gonna go ahead and palpate your stomach. So or your whole abdomen. So I'm gonna be moving in like a wavy motion just to feel for any tenderness or pain. So you can go ahead and let me know if you feel any of that. As soon as you feel any pain, I'll go ahead and stop, okay?
Okay. No. 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 No.
Okay. And when was your last bowel movement?
About 2 hours ago.
Okay, can you describe it for me? What was the color and like shape?
It was brown and solid.
Solid. Okay. And then do you know what your urine color was?
It was yellow.
Okay. And then how often do you use the restroom?
About 3 times a day.
3 times a day. Okay. Alright, so next I'm just gonna go ahead and move on to your extremities. So I'm just gonna go ahead and inspect your arms really quick, making sure that they're the same length. So symmetrically they look the same. Again, I'm just gonna go ahead and make sure that your skin is intact. Okay. And then skin color is for ethnicity. Okay. And then no moisture. Alright, and then for this one, I'm gonna go ahead and palpate, but I'm gonna use the backs of my hands this time, just so that I can measure your temperature, okay?
Okay.
Alright. Okay, so temperature is warm to touch. And then I'm just gonna go ahead and measure your radial pulses. You can turn them over. I'm just gonna make sure that they're symmetrical. Okay, so they're symmetrical, bilateral, 2 plus. Alright, and then I'm just gonna have you go ahead and squeeze my fingers for me. Squeeze them as hard as you can. Okay, thank you. And then if you can go ahead and stick your hands out for me, I'm just gonna test for your capillary refill. So I'm just gonna be pushing on your nail beds. Okay, so brisk capillary refill. You can go ahead and put your arms down. And then if you can go ahead and close your eyes for me, I'm just gonna test for sensation. So I'm just gonna be touching your arms, and you can go ahead and let me know which arm I'm touching, okay?
Okay. The right one. The left one. The left one. The right one.
Okay. Alright, so I'm going to go ahead and do the same thing. You can go ahead and open up your eyes. I'm just going to go ahead and do them for your lower extremities. So again, I'm just going to be inspecting, making sure that your skin color is correct for ethnicity, making sure that there's no moisture, your skin is intact and dry. Again, I'm going to go ahead and use the backs of my hands so that I can go ahead and feel for temperature. The temperature is 1 to touch. And then again, I'm going to go ahead and test your strength. For this one, it's going to be a little different. You're going to put the palms of your feet on the palms of my hand and push like if you're pushing on a gas pedal. Thank you. And then I'm going to go ahead and feel for pedal pulses. So I'm going to go ahead and feel here, making sure. Okay. Very symmetrical bilaterally. Okay. And then again, I'm just going to go ahead and have you close your eyes for me. And then you're going to just let me know where you feel the sensation, okay?
Okay. My left leg. My right leg. My right leg. My left leg.
Okay, and go ahead and open up your eyes for me. So I'm just going to have you go ahead and turn and face that wall for me really fast. Thank you. I'm just going to go ahead and also take one last time, this time the back of your lungs. So same thing that we did earlier, you're just going to go ahead and take the deep breath in and out every time I place the stethoscope on top of your chest, or on top of your skin, I'm sorry.
Okay.
Okay. Go ahead and deep breath. Okay, thank you. So you can go ahead and switch back for me. Okay, so I'm just going to go ahead, put these supplies to the side. Alright, and then is there any questions that you have for me, anything that I could do for you?
No.
No? Okay, so I'm just going to go ahead and leave a call light here for you, so in case that you do need anything, I'm going to make sure that the bed is locked. Are you in a comfortable position? Do you feel like you need to move anywhere?
No.
No? Okay. Alright, so if you do need me, just go ahead and give me a call, okay?
Okay.
Alright, so I'm just going to go ahead and gather my supplies and clean up. Then I'm going to go ahead and perform hand hygiene. And then I'm going to report back. So based off of my vital signs, I got a heart rate of 82 beats per minute and a respiratory rate of 12 breaths per minute. Blood pressure was 112/76. Patient was alert and oriented ×4. Speech was clear. Patient's pupils were equal, responsive to light. Equal and responsive and reactive to light. Patient has a abdominal. Through the abdominal session, we find that patient has pain of an 8 out of 10 due to gastroesophageal reflux disease. The onset lately has been the past month. Location is in the upper abdomen. The duration will last between 30 minutes to an hour based off if the patient has not ate or has ate a healthy meal. So those would be the precipitating factors. Associated with this would be nausea and vomiting. The patient's thoracic area, there's even and unlabored breaths. Lung sounds are clear. S1 and S2 are clearly heard. Patient's skin is intact, and skin turgor returns to the clavicle briskly. Patient's extremities have a radial and pedal pulse of 2+, which are equal and symmetrical bilaterally. Patient reports sensations equally bilaterally in all extremities. Patient's capillary refill is brisk. Patient is able to ambulate. So due to me making the patient shift from one location to the other, patient was able to do that. And patient reports bowel movements Last bowel movement 3 hours ago. The bowel movement was brown and solid with urine that was yellow. Patient reports voiding about 3 times a day. And that is my head to toe assessment.